But we have many statutory roles, and how we carry them out is mainly with the help of our volunteers. And we have a board of trustees who are all volunteers. We have an advisory group, again, volunteers. We have some Youth Watch members who are volunteers. And we do, before the pandemic, we did something called an interim view, which we have the statutory duty powers to go into care homes. And we go into these care homes and we look at what's going on in them, speak to the residents, speak to the staff, speak to family members, and we then can make recommendations from them visits. Unfortunately, with the pandemic, that's not been able to be done. So hopefully we will be able to pick that back up again at a later time. We host a maternity voices partnership. We do a lot of signposting. Again, our volunteers are massive key to this. And we know that things are letting us, we can do stall holding again at places. So one of the main things, as I said, that we do is the volunteers are absolutely vital to our organisation. You know, it's really important that we have our volunteers to help us do the work that we do. We're a very small staff team, but we do currently have 18 volunteers. So there's a number of reasons why you can volunteer, and it's really important for people to volunteer. It builds your self-confidence, you can build your CV up, you can also build your own skills, you can do training, you can meet new people, insights into the work that we do and things locally. As I said before, the volunteers are a vital role to our organisation. Links with the community. If you've got good links within your community, volunteering is ideal because you can share the feedback with them, gather their views and share information back to your communities, massively to make a difference. And the feedback that we gather in makes a difference locally. So by being a volunteer, you're helping gather that feedback in and helping make that difference. You can build up hours as well as part of work experience, and a better understanding of health and social care in the Rochdale Borough. Over the COVID pandemic, a lot of people haven't been able to get work experience to build up skills for university and things like that. So by volunteering in general, you can build up them hours, and it's really good for when you're doing your CVs or your personal statements for higher education. And we can do things like micro volunteering. So all the roles that we have, we can condense them into shorter ones to help build those skills. So one of the things that we do as well is, now that we've been able to, we can gather our volunteers together again. It was absolutely lovely last year. This was a thank you event which should have been part of Volunteers Week in June, but because of the pandemic, we couldn't meet face to face. So at the first opportunity in September, when we could get people together, that's exactly what we did. We got people together. So what we did is we had an afternoon tea at the Flying Horse in Rochdale. We have quite a few of them, our volunteers came along alongside the mayor, and it was just absolutely lovely. They had goodie bags and little thank you cards and things like that, and it was just so nice to see everybody after such a long time and not being able to see people face to face. And also, since then, we've had a couple of other coffee gatherings. We have been meeting on Zoom as well and catching up with each other. Also, some of our volunteers help us with social media campaigns. In the picture in the middle there, that's Mel, one of our board members, and we were doing a raising awareness of having the COVID vaccination. So Mel was our poster girl for this, and it's coming up to Volunteers Week in June as well. So if you subscribe to our social media channels and our newsletter and things, there will be more information, especially during Volunteers Week, on the different opportunities that we have as volunteers. We do have an admin volunteer, Elizabeth, and she's been with us over 6 years now. So she's our longest standing volunteer, and we're very proud of the work Elizabeth's done. And even in the pandemic, she worked from home for us doing admin tasks and things. So the roles can be adapted. Between December and February, December last year and February this year, our volunteers gave 84 hours to our organisation, which is really, really good, between meetings, gathering feedback and stuff like that, as well as training that they went on. So we got 84 hours, and like I said before, we currently have 18 volunteers with us. One of our volunteering opportunities is our advisory group. Now, our advisory group are made up of, at the moment, we've got 6 members, and we have a chair, Karen Kelland. We always need new members for our advisory group, and we're always on the lookout for new members. They meet monthly via Zoom at the moment, just because it's the easiest way to meet, with everybody living in different areas and other time commitments and things. And the role of the advisory group is to ensure that the views and experiences of Rochdale citizens in relation to health and social care are coordinated and communicated to our board, of trustees are at the top. It's to inform and support the decision-making process, ensuring that decisions made are focused on local need. With our advisory group, when they meet, they get a report every month of all the feedback that I've gathered in. It's narrowed down into categories and things, as well as we use local care opinion information as well and feedback. And they do use this to talk about issues, look at what's going on locally, and see if there's specific trends in feedback as well. So with our advisory group over the last couple of months, there has been key things what has come up. Access to dentistry has been massive, not just for us as Healthwatch Rochdale, but nationally across all the health watches. Access to dentistry and access to GPs is a massive part of the feedback that we're getting in at the moment. We did have a lot of inquiries around support for adults with autism within the Rochdale Borough, what the pharmacy offer was, because things have changed now within pharmacies, mainly over, again, through the COVID pandemic. Hospital discharges, GP cross-boundary issues, ear care services locally, menopause support, what there is locally. When we first got inquiries around this and we inquired out, there was very little support within the Rochdale Borough for menopause. And as these last couple of months have gone on, we're now finding that there is a lot more coming out around the borough, especially like in Fairlinch Park. They've got a little hub there with the vintage works who do a weekly session. So there is things going on. So sometimes it's about inquiring, but then things do pop up in the Rochdale Borough quite a lot. Another thing that we did was a moving on service report. We got a lot of feedback in around a service that had shut in Middleton, and that the service users weren't happy about this, as well as residents weren't happy about this. So we did raise this issue, and we did a full report on this, which you can see on our website. Our other volunteering opportunity that we have is Youthwatch Rochdale. Youthwatch is a really key part of Healthwatch. We realised that we didn't gather as much feedback locally from young people, and so we looked at how we can gather feedback in from young people around health and social care, because issues for young people are very different to issues for us. Dentistry for us could be that we're getting false teeth, or that we need a scale and polish, but for young people it's more around like the orthodontics, where there's very long waiting lists for braces and things, as well as referrals. So it's a very different set of feedback that would come in around different topics. So Youthwatch is for young people aged between 13 and 18 years old, and they either live, work, study or access services within the Rochdale Borough. And we want them to be a volunteer with us, because again, like we were saying before, it can build up their CV, it can look good on personal statements later on, and just gives them experiences and skills. So it's to volunteer with us to gather feedback from friends, family, schools, colleges and the community on health and social care. But also we do monthly meetings online via Zoom. So on the monthly meetings, we have guest speakers. The young people ask for the guest speakers, or it comes in from other feedback or trends that we're looking at for young people. We've had some guest speakers on who've told us about COVID vaccinations for young people. We've had the Rochdale Young Carers Hub give information. This month, which was yesterday, we had a careers advisor on telling the young people about all the different options that are available to them. And we've also had Rochdale Borough Council on looking at the No Place for Hate campaign locally. So the young people have took these things back as well to their schools or educational establishments. The Zoom meetings are the second Tuesday of every month online, and they're just for an hour. And we normally have the guest speaker, and we just have a bit of an informal chat and discussion and talk about any feedback that they've received. And the aim of Youthwatch is to engage the youth of Halewood, Middleton, Rochdale North, Rochdale South and Pennines on health social care matters, giving them a greater voice and inclusion, because it's massively important that young people are heard. You can sign up to be a Youthwatch volunteer on our website, but also you can sign up for our next bit, which is, well, this is the other part, it might be a bit further on, is our Youthwatch 100. So the Youthwatch 100, again, it's massively around ensuring that youth voice is heard. So you can sign up to this so that you receive the surveys through your email every single month, or if you check on our social media channels and things, then it tells you when it's gone live and you can access the survey through that. One of the ways that we wanted to gather more youth voices with the Youthwatch 100, the idea is that 100 young people sign up to it. every month they get sent either a survey or a questionnaire or a leaflet or something to review. They fill it in, send it back to us, and they get put into a draw at the end of every month, and they could win an opportunity to win a £20 voucher. And the £20 voucher is a voucher of their choice. So January's topic was the COVID vaccinations and flu vaccinations. February's topic were around hate crime and racial inequalities. March, we had a little bit of a break because we did some online feedback and things. And then this month's survey is all around the use of social media, young people's use of social media, and our Healthwatch's social medias for them to have a look at and review, because we want to ensure that it's accessible to all, and it's the young people especially are taking an interest in our social medias. So again, people can sign up to the Youthwatch 100. Again, it's for young people ages 13 to 18 if you live, work, study or access services in the Rochdale Borough. And some of the surveys as well are used in general with the feedback what comes in. It is looked at anonymously as well. So the young people don't have to worry that we'll be telling other people such body said this, so it is all anonymous what comes in. And it is just an area where you can put your name and email address so that you can go in the draw for the £20 voucher, but your name and email address will not be used on any of the survey information.